participants on for all. She will be monitoring that chat. And so she'll keep an eye on any questions that maybe pop up for the panelists, and interject those as is appropriate and make sense for the context of the conversation. So please get to know each other in the chat. And without further ado, I will go ahead and formally begin our coffee chat for today. So today we will be talking about securing new business, what to know about acquiring hospital, event, and even school security contracts. I am pleased to introduce our panel today of experts in each of their independent fields. First, we have John Coleman, Manager of Security Compliance and Training, over all of security for Pomona Valley Hospital Medical Center. Then we have Gus Kontopoulos he is the QM for Elite Security and Staffing. He has over 30,000 hours logged in the field of managing security for over 1,500 stadiums, 1,000 arenas, 500 conventions, over 1,000 fairs and festivals, and over 1,000 other sporting or special events in North America, Europe, Africa, and even Oceania. So we have a really great background for him in the event space there. And lastly, our panelist, Michael Hallinan, is the Assistant Vice President and Director of Campus Safety and Emergency Services at Claremont Colleges. So he has been in this position for some time, but he has over 34 years of experience in public safety and as a law enforcement professional. So he has a really wide variety of experience, and he has brought that to the Claremont colleges and communities, where campus safety responds to all events from emergency, fire, medical, and even criminal calls. The department also provides security-related non-urgent services such as key services, dedicated patrols, special event staffing, and after-hours support. So really dynamic roles for all three of these professionals. We're so honored and thankful for them to volunteer their time. All of our speakers for Coffee Chats are volunteers. So thank you all for being here with us today, gentlemen. I can't wait to dive in. I'll open with a question for all three of our panelists in no particular order, whoever feels most called to respond first. What are the top considerations that a PPO, we have a whole bunch of PPOs on this call based out of California here today. What are the top considerations they should keep in mind when entering a new vertical, whether it's education, healthcare, or the event space?
I'll start, I guess. I think first off, in the event world, I know many of the insurance policies out there. I think a large majority of them have event exclusions. So first and foremost, you want to make sure you have the insurance to actually do the work. Some of them are event specific, some of them are crowd size specific. So obviously, the first thing you want to do is make sure you have the insurance to be able to do it. I think the second thing is I mean, I think all three of us have pretty specialized industries, but events and crowd management are alcohol fueled environments. So making sure you have individuals that are used to dealing with crowds. If you've got a traditional, commercial security company where you're working apartments, shopping centers, things of that nature, throwing some of those guards without the proper training or experience out in the middle of an alcohol fueled environment, and expecting them to perform is quite an expectation, and many times it's not met. So the third thing is just the training. If your guards go through a basic 40 hours of training and they don't have any crowd management experience, again, there's a lot of good elective modules you can take in getting your guard card. But if you're not having your guards or your guards haven't gone through this training before they come to you, the evacuation training is very important. The fire modules are important. And first and foremost, the crowd management modules. So really, other than that, if you've got leadership that have experience in the area, it's going to make things easier. But, a concert with 25,000 people is not what you want to have baptism under fire for.
I love that perspective, Gus. I think that's a great list of top considerations as we talk about moving into that as events as a new vertical. What about you, John?
Yeah, all of Gus's points were really good. I think I would seek out a mentor. So whether it's someone in the space already, another security company, or even the event space themselves. Um, I've been amazed at sort of how friendly and all the networking capabilities there are. I'm sure CalSaga could help with that, but find someone who has been there, done that, and can pass on some of that wisdom.
That's such a great idea, John. And I think it's such a great point, to bring up. John is also a member of my ambassador committee. So that's a great segue to all the amazing connections that you can find here at CalSaga. And I also forgot to mention, Gus is a board member and has been for some time with CalSaga. So some really great connections here. And then Michael, who I'll ask you to share last but not least, is a new member of CalSaga. So just joined, and we're so excited to have him be part of the CalSaga network officially now as well.
So, I think I'll just echo Gus's point about training. You have to know your environment and where you're working. Like the school environment has been really challenging, especially this past year with many protests. Now we got some, political stuff going on. So the college environment is always, and you have to know your audience too. The colleges are really super tricky. So what I do with my own staff, and then I also hire outside contract security when events are large. So I make sure that they have proper training. Medical training is really important for campus safety officers. That because we respond to overdoses, they're all Narcan trained. They have stop the bleed kits. We have AEDs. Ensuring that the officers understand what their mission is. We just had a pretty large swatting call on our campus where we were doing evacuations and other buildings were sheltering in place. And so it's really understanding that the officers understand their role, that they're not the police, and what their role is to provide safety and security for the campus and make sure they're instilling calm. So we do a lot of extra training every year, probably upwards of hundreds of hours. So that's what I would just say: know your environment, understand your training options.
I promised that I wasn't going to throw them any curveballs, but all three of you highlighted training to some extent. And so my next question is a question for all of you. I'm just going to tweak it a little bit. The question was really about how do we do people management? And I'll drill into that a little bit more in a second, but starting with training, like what are the top things in each of your respective verticals that you consider to be highest priority when you're training your own staff?
I'll start with that one because over the last 12 months or so, we've kind of overhauled our approach to training at the hospital. And for us, it really came down to two things. And the first was we wanted our training to be based on reality. And so what I mean by that is we wanted to move away from just checking a compliance box to making it something that our officers were going to get something out of. And so our role playing, our scenario training that we implement is based off of incidents that we've dealt with. And maybe it was an incident that went really well. Maybe it wasn't an incident that went well, but we're always looking to learn and improve on the situations that we're actually dealing with. And then the other one is sort of that idea of an ROI. And that goes back to, again, not just wanting to check a compliance box, but if we're going to spend the time and the money and the resources to train, we want all of our people to walk away from that better at their job and more confident. And so, related to that, we took all of our training in-house and chose to elevate, a number of our people who have the experience and have the background and have the passion for communication for training, and give them the, the instructor certs, as opposed to relying on outside services who might be an expert on pepper spray or something like that, but aren't familiar with our unique setting.
I'll go next. For us training, we work with a lot of professional sports leagues, professional sports teams, and when we see those RFPs, they've got some pretty stringent training requirements and certification requirements in them. And being able to put all our people through that training kind of trickles down to even the smallest of events. So for us, there's two primary areas that we focus on. One is trained crowd manager certification. NFPA is a private organization, but many states embrace their code book as their state fire code or their local fire code or portions of it. So if you look at NFPA 101, it's got something called trained crowd manager in there, and a lot of these jurisdictions are requiring that. So for us, it doesn't say that the security team has to be the trained crowd managers, but many of those RFPs put that burden on us. So for us, trained crowd manager certification is the first thing we do. It's a 4-hour program. We've integrated it into our BSIS elective modules, so we're kind of killing two birds with one stone. We developed the training program ourselves, meeting all the check boxes that NFPA puts in. So basically, the trained crowd manager certification for our people is number one, and then alcohol management training is number two. We generally embrace the techniques for effective alcohol management program. We've got a hybrid where we inject a lot of, I shouldn't say a lot, but a significant portion of it also deals with drug and disabled person awareness. A lot of times somebody that's taking a prescription drug, or somebody that might have a medical condition, appears to be intoxicated, and you want to be able to train your people to tell the difference between the two. If somebody's stumbling, you can't just assume they're under the influence of alcohol. So really, those are the two areas we focus on: trained crowd manager, which has evacuation, shelter in place, general crowd management, active shooter, things of that nature, and then the alcohol program with the add-ons that we put with it.
I love that. John and Gus, you really took it away, but I think Michael, you really kicked it off, as you already talked a little bit about the hundreds of hours annually that you're putting your officers through, your campus safety team and all of those folks. I don't know if there's anything else you want to expand on.
Yeah, we do more of a hybrid too. We do a lot of in-house training. So all new officers go through 480 hours of in-house training before they're released on their own. So, but our environment is pretty complicated. We have 7 colleges, we have 5 undergraduate universities and 2 graduate universities. So they have to know the campuses, and you could be on one street and on one campus and take 2 steps, and now you're on a different campus, and different expectations, different understandings of what they want from us, and we have different service level agreements with each of the campuses. So the officers have to know that. So it does take a lot. We also do yearly training where we work on the basics, evacuation stuff, fire drills, making sure officers understand their roles, and and then we do tabletop exercises for like management. So all the officers have taken all the classes: 100, 200, 700, 800, and then there's 904, 905, and 907, which are the active shooter ones: active shooter response, active shooter what to do, and active shooter preparation. So all my officers take all those, and then our outside firm that comes in extra when I need extra bodies, they have significant training also.
I love that. Well, so for me, promising no curveballs, and then the very second question that I asked you all, I threw a little bit of a curveball. Let me just expand a little bit more when we talk about people management, And let me ask specifically, I'm really curious about managing staffing ratios in different environments. So, John, as you talk about the size and scope of your hospital, what do some of those ratios look like? And you can divulge obviously as much as you're comfortable in terms of the numbers, or you can give us examples. But I'm curious for each of you in your respective lanes, what is your approach to that supervisor to officer ratio? Or adjusting guards based on things like student population versus attendee population for the various events? And how do you sort of scale and plan around that?
Yeah, that's an interesting question for hospitals because a lot of the metrics that they drive staff levels off of is the patient census. So how many patients do we have in the hospital? And that impacts security's workload a little bit, but it's not like it does, a nursing workload. And so we tend to follow more of like a square footage formula. And I know IHSS has put out like some specific guidelines as far as square footage and security staffing. We're very fortunate at Pomona to be super well resourced. We are a level 2 trauma, so we run about 15, a 15-1 supervisor to officer ratio, and are fortunate that we have really robust staffing levels.
In the event footprint, there's no magic formula that you can say we have this many people, so we need this many guards with this many supervisors. I mean, for us, each event is pretty much a project within the project. So for us, it has to be looked at individually. For example, if we're doing a large concert, we'll take a look at the backstage area, see how many set posts there are, determine, okay, we need X amount of relief people to be able to give them their legally required breaks, and then look at the geographical footprint. If it's in an arena, generally one person can supervise the entire backstage area. If it's in a stadium, which we do many stadium concerts, we generally have to split it in two based strictly on geography. If it's something that has a large trucks and buses lot, we've done shows where there's been 300 semis and trucks out in the parking lot, and they've wanted the backstage supervisor to supervise that. And it just doesn't work out geographically. You don't need a whole lot of guards to supervise that area if it's in a fenced environment. But just to be able to leave a backstage area where it's very needy to go out and check on maybe 4 officers working guarding trucks, which is not a very needy area. It just doesn't work that way. So we've got individual formulas that we use. I can tell you how many people I can get into each magnetometer an hour. Look at the crowd attendance, look at how many magnetometers they have, kind of take a look at, okay, traditionally, when do these people show up? Is this an event where people show up early? And if it is, you want to have fully staffed people there at the beginning. If it's an event where they tend to show up late, maybe you can stagger your staffing in. But again, another example is if we're doing a stadium show where it's general admission and we're going to have a fully packed floor shoulder to shoulder, I may only have 3 people working the soundboard. However, that is a pretty needy area. And I'm not going to be able to get a supervisor there quickly if there's a problem because I can't parachute them in. They're going to have to get through shoulder to shoulder people. So I'll actually have a supervisor in an isolated area based solely on the necessity of not being able to get somebody there quickly if there is an issue. So to me, it's just a project within a project. Every little area we have to look at differently.
I love that. That was a great breakdown. Thanks for that, Gus. What about you, Michael?
Yeah, so obviously the campus is a 24/7 operation, and we also run 24/7 communication center, dispatch center that we're in direct communication with the police department at any given time too, and LA County Fire. But we have supervision on every shift, so the ratio is really about 6-1 because it's a high stakes environment. We deal with suicides on campus and other high liability stuff that we want to make sure that there's a supervisor at. When I hire outside help, the ratio is 10-1. So for every 10 officers I also hire a supervisor. And we use that for like commencement and they have like big weekends like alumni weekend or family weekend or different stuff that come up through the years. And then each of the colleges host huge parties, which we also hire outside staffing for. It just depends, but really it's about 10-1 for outside firms and 6-1 when I have my own people there.
Absolutely. Yeah. Those are some really helpful numbers as we begin to kind of unpack and imagine what each of these respective verticals might entail as some of these PPOs have their, wheels turning and they're starting to consider, is this something that I would maybe want to step into? So one of the other areas that I think is really helpful to look at, especially right now, I think there's so much on the market in the way of equipment. I have a question for you, John, specifically, and I think your background is so perfect for this question. So what special equipment, such as body-worn cameras, communication tech, non-lethal tools, etc., do you use in your hospital setting? And with that, I'm really curious, how do you determine what you're authorized to deploy in each setting? Like, how do you kind of navigate that?
Yeah, that's a complicated question. We could probably spend like 30 minutes just on all the different technology. And there's so much that's emerging in the field.
Yeah.
Hospital security, especially over the last probably 5 years, there's been a huge shift from observe and report, and in relation to sort of surging workplace violence numbers in healthcare facilities. It's a big issue. It's an issue for patient safety. It's an issue for staff safety. It's a big issue with nurse recruitment and retention as well, which is what's getting a lot of administrators' attention. And so, sort of gone are the days of contractor in-house security at hospitals that are just kind of hands off. So at Pomona, we're very progressive in that we're a PPO. We have pepper spray, baton, taser sevens, 4 full-time K9 teams, 700 something cameras, digital encrypted Motorola radios, 24/7 dispatch, all sorts of stuff, license plate reader cameras at entrances. And a big part of that was the need, rougher area town, hands-on situations are very frequent. And so needing to keep our officers and our staff safe. We also contract with companies for supplemental security, and on that end of things, it's really pretty much just a radio. But to get to the point of your question about the when and the where and the how and the why, and yeah, there are some unique considerations for healthcare environment. In my opinion, it's the most heavily regulated security environment there is. We have the Joint Commission, we have Center for Medicaid, we have state and federal, departments of public health. There's county level things. It's just a lot that goes into it. So there are extra considerations we have to take. Like, for instance, we can't use handcuffs on a patient. We can use medical restraints, but that's a whole thing in and of itself. We can only use handcuffs on a patient if we're actually effecting an arrest. They can't be used as like a stopgap between getting maybe a psych patient back into bed and into medical restraints. So that's a special consideration. When we're talking about pepper spray in a clinical environment is a tricky preposition. So we use the gel spray, so it aerosolizes less. But our consideration, if we're using it out in the parking lot versus if we're using it in the emergency room, is going to be completely different. Hospital environments, there are weapons everywhere. IV poles. I've had patients use oxygen tanks as battering rams. So these are also things that we have to consider. Yeah, there's a lot that goes into it. It is a very complicated environment.
Absolutely. Well, I'm glad you broke that down as simply as you could for the short time we have here. I think that gives folks a really broad perspective as they start to maybe consider, transitioning into this vertical. Um, the next question that I have it for you, Gus, but I did hear Michael talk about some of the subcontracting that he does with um with additional outside security for the Claremont colleges. So if you'd like to chime in as well, Michael, I would certainly invite that. But Cal Sega, as we shared, we talk about this a lot. We really try to provide our members with ample opportunities to network and connect with other PPOs, and in some circumstances, other PSEs, and work towards building relationships with each other. So with that, I'll ask, how do you recommend that firms strategically build relationships with other PPOs, with other security, directors, whether that be in-house or, across other agencies, for subcontracting opportunities?
Well, most of the RFPs for large events we're seeing now don't allow subcontracting. We just closed a deal for our local fairgrounds here, and it prohibits it. Many of them that we're seeing are wanting permission to allow us to do it. But first and foremost, in my industry, it's really tough because 90% of the PPOs out there don't have insurance to do event work. The 10% that do, two or three of them are large competitors. So generally, that's not something that makes sense. So for us, unfortunately, it comes times where we have to flash hire, pay for the guard card, put them in a low risk environment, closely supervise them because they're newer people, and take it from there. So in our end of the industry, again, first and foremost, when people contact us, we ask them for a copy of their insurance policy and all the exclusions. And in the past, we've had people that haven't supplied the exclusions. We found out after the fact that they don't have the insurance for it. So for us, it's incredibly challenging because there's a level of trust involved that unfortunately has come back and bite us in the butt. I don't want to hire a company that doesn't have that coverage. Obviously, I want to be indemnified for the actions of their employees.
Yeah.
And if they don't have the insurance for it, it's going to fall back on my insurance. So now I'm basically putting my insurance premiums in somebody else's hands. And I'm not going to do that. So in our end of the industry, it can be done, but it's incredibly tricky.
Yeah, that makes a lot of sense. So I'm curious to hear kind of your perspective, Michael, sort of on the other end, and obviously coming from the college campus perspective at this point.
Yeah, so I'm looking for something a little bit different, to the effect that it's really ease of use. So, the companies that I used are larger companies that could give me staffing at a moment's notice, with a day or two, sometimes even same day. So they have plenty of personnel, and they never say no. So if I need staffing, they give me staffing. So that's really one of the key factors I look for. So is, a company that's large enough that could do that, that has hundreds of employees on standby to work different events. And then they're a professional, so they understand the college environment. They have proper uniform, and they understand how to interact with the campus population.
Yeah, all of that seems huge. And I know it's a delicate balance whenever we're working between knowing that we're ultimately hiring our competition to some degree for those of us that are in the PPO space, to those of us that are in a position like yours, Michael, or yours, John, really understanding what it is that we're asking of a PPO, what we're asking them to provide. I think Gus did a good job of spelling out, I need to see a copy of your insurance, and I'm going to send that over to my insurance broker, and I'm going to make sure that I understand what it is that you're insured for and what you're not insured for. So that makes a lot of sense. So my next question, another one, excuse me, for you, Gus, because you sort of touched on this already. Event security can be unpredictable. I am curious, how do you prepare proposals that account for rapid shifts in risk or scale? And then again, I'll tag Michael in to the other side of that, and kind of what are the things that you're putting out there when you're looking for PPOs. I know you touched on obviously a few of the considerations that you have, but Gus, I'd love to hear your thoughts, and then we'll shift over to Michael. And then I have one coming for you, John. Don't you worry.
Um, looking at it, I'll have to split it up in two different types of RFPs. So if it's an RFP from a client that wants us, or potential client that wants us to present it in a desired format, generally that format gives us the opportunity to sell ourselves as somebody that has the qualifications to do this work. Section 1, how long you've been in business. Section 2, how many guards do you have currently? Section 3, give us references, et cetera. So if there's any gaps in the questions they're asking to prove our ability to do that, we generally, supplement it at the very end. Here's some additional information we feel is relevant. If they're asking us just to make a raw presentation to them, obviously ability to perform is the best way to do it. And depending on the size of the client, generally you don't see RFPs from somebody that wants 10 people for a street fair. They just say, hey, give me some information, give me your rates, and you're off to the races. And generally, a lot of times those go to the lowest bidder, which historically hasn't been us. But for some of the larger ones that will allow us the freedom to put that proposal in our own format, using examples of success is really the best way to do it. In the past, when we were managing 3 NFL teams, we were shifting people back and forth from state to state to make it work at times. But generally just having the labor resources, showing success stories where you've been able to manage multiple events, multiple major events on the same day. We've got a fairgrounds, a ballpark, an arena, racetracks, things of that nature. So giving them examples to where we've been able to manage 5 major events in the same day, with another 100 people in the event industry working miscellaneous smaller events, and the other 200 working our regular commercial sites on a regular basis. So really proving your ability to perform, and then showing success stories in your response is the best way to do it, and showing you have the insurance. I'm going to keep circling back to the insurance. Proving you have the insurance to do it, to separate you from those PPOs that don't have it, that still bid the job and take the risk on.
I feel like I should throw the disclaimer out there. Gus does not get any kickbacks from any particular insurance broker.
No, I'm not going to mention names.
I'm joking, of course, but Michael, I'm curious to hear sort of your perspective on that same question, adapted more towards the person who's looking for a prospective security provider, and what are you putting out there? What do you want? What would you like to see in those proposals?
Yeah, it's interesting. Everything Gus said is what I look for. It's the ability to do the work, proven track record, references, all that. So, I would never hire a firm that, I think, they promise everything, but they have nothing in the background to show that they've ever done it. Maybe they're starting out, but you have to have some type of track record, especially in this type of environment.
Yeah, absolutely. I love that. And I love that you're both so on the same page, which is awesome. All right, John, I'm coming for you. I promised I would be. So healthcare facilities tend to come with high stress environments and legal sensitivities. How do you build trust with your hospital administrators? And you sort of touched on this earlier when you mentioned a lack of security. We know there's a direct correlation, a direct contribution to high nurse turnover. And that's something that obviously catches administrators' attention. So I don't know if you have more examples like that, or more, specifics that you can share on how can a security provider in that environment help to build trust with those hospital administrators?
Yeah, good question. So in our environment, we kind of have two kinds of contract security, right? We have the supplemental, like what we use at Pomona, where they're helping us with exterior patrol and our guard shack and stuff like that. And then you have hospitals that do contract with the company for their entire security program. So I'm going to answer this sort of more geared towards a PPO that is the entire security program for a hospital. Administrators are relatively simple. They care about ROI, they care about value. They care about customer service. If you say you're going to do something, do it, follow through, all of those like business fundamentals. And you're going to have a happy group of administrators. I think the more challenging relationship to foster and to build trust in is with clinical staff, especially nurses. There's a emergency room nurses association. It's a national association that did a survey last year, and of the couple thousand nurses that they surveyed, 56% of them had been assaulted in the previous month. So when we talk about workplace violence for nurses, especially emergency nurses, it is not an abstract thing. It is something that they are dealing with sometimes on a daily basis. So that becomes a little bit more challenging. You really do, if your guards are showing up to a call and they are not making the staff feel safer with their presence, then you need to evaluate why that is. Is it an issue with they don't look professional and they don't have that command presence? Is it an issue with they weren't given the appropriate training for that post? Like whatever that is. Once you start winning nurses over though, like that's 80% of the battle there.
Yeah. I didn't want you to feel left out. So my wonderful co-chair, Shayla, brought it to my attention that you have a few more questions that I'd love to just roll them all up here together. You did such a good job hitting that one out of the park. So one of the questions that came in was, do the tactics that you use in a hospital setting, and I think we can kind of broaden this a little bit and say the overall approach to the best of your knowledge, Don, does that apply in those medical clinical settings as well outside of the hospital? Or kind of, can you give us a general understanding of what the key differences are between a hospital and that kind of medical clinical setting?
It does, but you just have to understand that everything's heightened. No one wants to be at a hospital. So you're dealing with people, whether it's a patient or a visitor or even staff members. You're dealing with people sometimes on the worst day of their life, maybe. And so all the emotions are heightened. And then obviously we're dealing with psych patients. We're dealing with sort of that revolving door of 5150s. People on the wrong meds, off the right meds, drug seeking, all the above. And so it's one of those things where you will get a lot of experience very quickly, even as a new guard, using your verbal de-escalation tools and building that command presence and all that kind of thing, if that makes sense.
Absolutely. Yeah. No, I think that's really helpful. And then one more just kind of quick question. I know you've sort of touched on this in our conversations, and I might have saw something in the chat about it. I don't, from my understanding, you guys are not currently using body cams. I don't know how much HIPAA plays into that, but I'm just curious, what does your magic crystal ball sort of say on how you think that we'll be able to reconcile HIPAA and body cams in the future at some point, or where is your mindset sort of on that?
Yeah, so we do not currently have body cams at Pomona Valley. It is something that we are looking at. There's a lot of things that go into that. One of those is the HIPAA. For anybody not familiar with HIPAA, it's the federal patient privacy laws, and they are very strict. My understanding from some of the research we've done, and IHS has done some webinars specifically on this topic, is that as long as the data is treated and protected like any other PHI, which is protected health information, then from a HIPAA standpoint, you're okay. I think the trickier thing in California is that California is a two-party recording consent, state. And so when you're talking about recording audio specifically, it can get tricky. Most people agree, though, that if you have appropriate and enough signage, at your entrances and so on and so forth, that you can get around that. But yeah, it is something that there's a lot of things that go into that, even including, getting HR's buy-off. We have 3,000 associates. So not all of our associates are on board with being recorded in an environment like that. So I hope that answers that question.
Absolutely. Yeah. Thank you, Don. I appreciate that. Michael, I have one final question for you specifically, and then I'm keeping a close eye on the time. But if time allows, we have a couple more all panel questions that I'd love to get thoughts or feedback from each of you on. But my question to you, Michael, is I'd love to hear your perspective with 34 years law enforcement experience. Obviously, now you've had a good amount of time in the college setting, and Claremont colleges are particularly unique because you actually have multiple college campuses that you're serving, and you sort of shared some of the different components that you're managing from a security and safety perspective. But my question is this: how has the conversation around school security evolved in the last maybe 5 to 10 years? And how can companies reflect that evolution in their approach? And I want to keep in mind, obviously, your experience isn't necessarily in the K through 12 setting, but I'm hoping maybe you can apply that to that realm as well, because we have PPOs that are maybe looking to step into the K to 12 environment for physical security. There might be a little bit more of a of an opportunity there for that as a vertical for a lot of the folks listening in today.
Well, and I'm gonna lump, so you have to understand your global environment. So the stuff going on in the world, like you look back, like the last 5 years, you had like George Floyd incident, and it was anti-police. But I'll tell you, security, my officers get grouped in with the police all the time. They call us the police, the police, but they believe we're law enforcement. So it's making sure that your officers understand the global environment. So, most recently this last year, we had a bunch of the pro-Palestinian protests on college campuses, including our own. We had, millions of dollars in damage to our school, which is crazy, right? And then, most recently, we have all the political stuff that's going on, the anti-immigration stuff, and people are fearful. So making sure your officers understand the complexities that, we're not the police, we're more like ambassadors to the campus, having that type of mentality that we're helpful, we're not enforcers. And then John made a good point. You have to make sure that you're selling your customer service. People have to appreciate us, and when they don't, and they provide feedback, you take it seriously, and then you get on a corrective course. So it could be the way, somebody talk to somebody. They probably need some better training. And I personally interview each staff member that comes in that we hire, and I ensure that they have a service mentality, that they act in good faith. I provide clear expectations, and they know what their role is. And when they fail short, and they will, because they're humans, we're dealing with humans, they're going to fail short sometimes, and you have to provide some corrective measures how they could succeed, and then give them, re-clarify your expectations with them. So it's time consuming, but it pays dividends in everything that you do. But you have to have customer satisfaction, or you're not going to last.
I love that. I think that's a great segue into our final two questions. So I'm going to do this first question. I just saw it come in through the chat, so I think it's timely and relevant, but I'm hoping everyone from the panel can give a sort of a condensed version, because the final question is more of a fun one that I want to close on. What is everyone's thoughts on Narcan in each of your respective lanes? And John, obviously, you'll probably have a really unique perspective, but do you allow your officers to administer Narcan? Thoughts on Narcan in 30 seconds or less. Ready, go. We'll start with you, Gus.
Event officers know. When we work events, there's always medical personnel on site. I know it's a timely situation when it's needed, but with trained medical professionals at every event we work, let the professionals do it.
I love that. I love that perspective. John, obviously you have a really unique perspective, so I think I know the answer here, but I would love to hear it from you nonetheless.
Yeah, that's a great question that I hadn't necessarily thought of before. So we're a hospital. We have clinical staff anywhere and everywhere. We do still train our officers, our in-house officers, on Stop the Bleed. They were mandated to have BLS, CPR, renewal, all that kind of stuff, because you never know if something's going to happen out in the middle of one of our parking lots or something.
Right.
We have Narcan. As I'm looking at the 50 feet outside my office window, actually, we've got free Narcan like distributor outside the ER. But we're going to leave it up to the clinical staff whenever we can.
Yeah, that makes a lot of sense. I was really curious to hear your perspective. And Michael, on the college campus, I know you mentioned dealing with drug overdoses and things like that. So,
every one of my officers has Narcan on them.
Okay.
So we carry it with us. They actually carry 2 doses with them at all times.
Yeah.
And because let's face it, kids don't make the best decisions, especially when they're away from their parents. And as a father of a college age kid, my kids aren't doing that, but you never know, right? It's like you never know what you're exposed to. Kids get taking something and they overdose. So it saves lives.
Absolutely. Well, thank you for that. I know that I promised you no curveballs, and now I've thrown you all 2. So with that, my final question, and we'll go in reverse order, starting with Michael. I know you have a hard out in just a couple minutes. So my final question for each of you, starting with Michael, can you share a lesson learned from each of your respective verticals? So something you learned in your time in this specific niche that you're in today, and what would you do differently now that you have had that experience?
Well, so coming into my role, I've been in this role for 2 years. It's really taking a look at your the BSIS requirements, and the rules. We weren't licensed before, and when I got here, I'm like, hey, where's our license? So I quickly got it, and it wasn't an easy process, as everyone knows. It's a lot of work, and so luckily we got licensed pretty quick, but it's really evaluating your situation and making sure that you protect yourself and make sure that you have the proper insurance, make sure that you have the proper licensing, that your officers are properly trained and they're properly licensed, and then you keep files on them. Making sure that I keep files on every single officer, making sure that their training is up to date. I keep detailed records, and it gets flagged if something's coming up towards expiration, like their either the licensing stuff or their medical stuff. So because every 2 years they go through medical training again. So we have a medical team. I have 6 trained instructors that could do the gamut of training when it comes to medical through the Red Cross. So it's pretty helpful with that.
I love that. That was a great perspective. And I know you're going to have to jump off here soon. So I want to just say a quick pause and thank you so much to you, Michael, for your time today. And we really appreciate all of your valuable insight. So we'll go John and then Gus with this final parting thoughts, a lesson you've learned in your respective vertical, and maybe what you would do differently now.
Yeah, I mean, I absolutely second everything that Michael just said, especially about the licensing thing. Hospitals, campuses used to operate in that gray area a few years ago, right? And I get calls almost every week now from hospitals just playing catch up and realizing that they're out of compliance, and trying to give them some pointers. I think for me, if I had the time machine, I would have started networking more earlier. In my previous job, in my previous hospital, I was an operations manager, and I didn't feel like I was closed off, but it wasn't until I came over to Pomona that I realized how many different networking opportunities there are out there. Obviously, CalSAGA has been a big one. For hospital security specifically, there's the International Association of Healthcare Safety and Security. They have a local chapter. If you are looking to get into this sort of vertical, that's kind of where I would start, is finding your local IHS chapter, because the connections that you'll make there are really going to be your best bet. So yeah, I think that's what I would do over.
I love that. Spoken like a true CalSAGA Ambassador Committee member, John. I didn't even put him up to that, you all. Seriously though, the networking component, I personally have gotten so much out of that over the years and our time with CalSAGA. So I think, looking for those other resources, that was one of the questions that didn't quite make the cut, was talking about, what a professional development and associations might be helpful. So IHSS is a great example of that. And I'm sure there's things like that in each of these respective verticals. If you're looking to break into a new market, that's definitely a great place to start. But doing what you're doing right now with CalSaga is obviously fantastic as well. I think it was you, Gus, that mentioned finding a mentor, and it might have been one of the other panelists. But speaking of mentors, I found my first mentor at a CalSaga event who really helped to grow our company when we first started and first joined CalSaga, and he was really critical in our time. So with that, I'll segue to you, Gus, for your final thoughts, lesson learned in your respective vertical. I'm sure you have plenty with all of your years of experience, but if you had to narrow it down to just one, and what would you do differently?
I think for us, a lot of our clients are transient. They come in, they do one large event a year, or they do one large convention and trade show in our market every 3 or 4 years. So not knowing whether you're going to have that work, throwing a bunch of bids out there that might overlap, to me, putting an expiration date on my proposals, saying this proposal is only good for this amount of time. That way, if we have other work that does come in that's confirmed, we can go back and say, hey, folks, we appreciated the opportunity, but we didn't hear from you. The proposal's null and void. And if they say we still want to work with you, then I got to take a look at my circumstances now. And if I'm looking that now to be able to service that one contract, I'm going to have to do some flash hiring, pay for the guard cards, incur a bunch of overtime. My rates just went up anywhere from 30 to 50% to them. And generally I'll lose the work, but I'm fine with that. I'm keeping all my people busy during that time frame and not having to incur the expense of going out and doing the flash hiring, paying for the guard cards, again, incurring the overtime, et cetera. So to me, we never used to have expirations on them. People would call us up, say we want to use you, and it's like, oh, too late. And it's a difficult conversation, but if there's an expiration date in there, this proposal is good for 30 days, then it's a much easier conversation to have.
What a great way we talk about this a lot at different CalSaga events and in different rooms and different conversations, but so much of our job is to educate our clients, right? And so by way of doing that, by slapping them with 30 to 50% increase, you're essentially retraining them. Like, don't wait till the last minute. You got this quote from me 6 months ago. If you had made up your mind and done what you're supposed to do, and maybe you didn't because you went with a lower bidder at that time, and now that bidder's dropped out on you. Same, we're educating our clients, like, you're letting them know, like, hey, that's what you get what you pay for. And so those conversations are just so critical. That education component is so important in the work that all of us do. So with that, I just want to say a ginormous thank you to all three of our panelists. I know Michael had to hop off already, but John and Gus, you all provided such great insight, and it's been so wonderful to hear your thoughts and your ample experience in each of these respective verticals and markets. Before I transition over to Kate, who will do some final housekeeping items and transition us, for those of you that want to join our networking, I highly recommend it. Kate will explain how that process looks in just a moment. But before we transition to that, I do just want to remind everyone, my lovely co-chair, Shayla, dropped a link in the chat, but our next coffee chat is already scheduled. So many of you have probably heard what's happening. It's getting a lot of attention in the media right now. There was a situation at a town hall meeting where folks who supposedly were security ended up getting into a really interesting situation. I'll leave it at that. You all can research it on your own. We're going to be having a full discussion around use of force liability, both civil and criminal, sort of spawned from this exact situation that's getting quite a bit of media attention right now. So if you have not yet registered for that link is in the chat, and I encourage all of you to register now. That way we know and we can plan for all of you to be there, and we can get it on your calendar and make sure that you have it ready to go. So with that, I'm going to transition over to Kate, who's going to discuss how the networking works and all the fun things to come.